Top 10 Deadliest Diseases. What comes to your mind when you think about the deadliest diseases on Earth? Let me guess. You might be thinking about fatal or incurable illnesses or viruses like the coronavirus. The truth is that these diseases aren't even in the top 10 deadliest diseases. Today, we are here to burst that bubble. According to facts, every year, around 54.6 million people die from diseases that progress slowly. The surprising yet unfortunate thing is that these diseases aren't taken that seriously. Statistics show that in 2015, 68% of worldwide deaths were because of slow-growing conditions. The most surprising part is that the deadliest diseases can be prevented by taking specific steps. Though there are many other factors that man has no control over, such as healthcare facilities, the environment, and being able to afford preventative care, today we are here with the top 10 deadliest diseases. Number 10. Cirrhosis. 1.2 million deaths annually. When the liver is scarred or damaged for an extended period, or if the damage is chronic, it results in psoriasis. Many diseases like hepatitis or alcohol abuse can lead to psoriasis. Kidney diseases are also considered the primary cause of cirrhosis. The liver is essential for our body. The liver filters all the harmful substances in our body, and then it delivers a healthy and clean blood to the body. The liver forms specific scar tissues when toxic substances harm it. Over time, if the scar tissue increases, the liver has to work harder to purify the blood. If the damage doesn't stop, the liver ultimately stops working. Factors to avoid. Here are a few risk factors you need to avoid. Alcohol abuse, hepatitis, a fatty liver. Prevention. To avoid any damage to your liver, you must prevent things that cause it. For instance, alcohol abuse is considered the primary cause of cirrhosis. Restricting alcohol intake can help in preventing the disease. It's scary how much fatty livers are common. To avoid any fat buildup, you must intake a good, healthy diet. Hepatitis is a hazardous disease itself. To prevent contracting it, you must avoid any contact with someone's blood. Avoid using razors, needles, or even toothbrushes. Number 9. Tuberculosis. 1.3 million deaths annually. A dangerous bacteria called Mycobacterium tuberculosis is the cause of tuberculosis, which is a chronic lung condition. The scary part is that Mycobacterium tuberculosis is an airborne bacterium. Though the disease is now curable, it's fatal for HIV patients. According to statistics, 35% of HIV-positive people die from TB. The fall of TB. Due to improvements in medicine, TB has been reduced by 1.5% every year since 2000. Scientists aim to end it by 2030. Factors to avoid: diabetes, HIV infection, underweight, exposure to TB patients, drugs that suppress the immune system, prevention. Vaccines like Bacillus calmette-guerin, or BCG, are given to children for prevention against tuberculosis. If you think that you have been in the proximity of a TB patient, you can start intaking chemoprophylaxis as a treatment to prevent developing the condition. Number 8. Diarrheal diseases that cause dehydration. 1.4 million deaths annually. In diarrhea, a person passes more than 3 stools a day. A lot of water and salts are lost from the body, which can cause dehydration during diarrhea. Extreme dehydration is fatal and can cause death. The most common cause of diarrhea is contaminated water. Other risk factors include intestinal virus. Impact of diarrheal diseases. According to facts, around 760,000 children under the age of 5 die because of dehydration caused by diarrheal disease. Diarrheal diseases are the second most dangerous cause of death in children under 5. Factors: poor sanitary environments, usage of unclean water, young children, malnourished, weak immune system. Prevention. The most effective yet easy way to prevent these diseases is to promote good hygiene in your life. Proper sanitizing is recommended. Hand washing is again a very important factor. Studies show that proper hand washing can reduce the risk of diarrheal diseases by up to 40%. The leading cause of diarrheal diseases is contaminated water, so you must intake clean water. Number 7. Dementia conditions, including Alzheimer's. When we hear about Alzheimer's or dementia in general, we assume it is a disease that causes memory loss. The truth is that dementia-related diseases like Alzheimer's cause memory loss and affects normal brain function. This disease progresses over time, affecting brain function, including thinking, reasoning, and typical behavior. The most common type of dementia is Alzheimer's. According to facts, 60 to 80% of dementia-related causes are Alzheimer's. The symptoms of Alzheimer's is very slight at the beginning. The patient may suffer from mild memory loss or difficulty remembering things. The disease becomes severe over time, and the affected won't remember events from the past. According to a study in 2015, it was estimated the deaths from Alzheimer's are much higher than they are reported. Risk factors: aging, people above 65, family history of dementia or Alzheimer's, inherited genes, cognitive impairment, Down syndrome, unhealthy lifestyle, females, head injuries in past, isolation or no social engagement for an extended period of time. The bad news is that dementia or its types, for example Alzheimer's, is incurable. Researchers have been working on the disease, but unfortunately, many advancements have not been made. Prevention. A simple way to reduce the risk factor is to have a good diet. Doctors suggest a diet high in green vegetables, fruits, good fats including fish and olive oil, and a decrease in high saturated foods like meat and dairy products. This kind of diet will protect your mind and heart. Number 6. Diabetes mellitus. Insulin production and usage are hindered due to diabetes. There are certain types of diabetes. The pancreas, due to an unknown cause, can no longer produce insulin in type 1 diabetes. Type 2 diabetes is somewhat similar. The pancreas produces insulin, but it isn't enough and its usage is ineffective. The cause of type 2 diabetes is evident. It includes overweight, unhealthy diet, and poor exercise. Impact on the world. Studies have shown that people from developing countries or the middle class suffer from diabetes complications leading to death. Factors: high BMI, aging, less active, poor diet, high blood pressure. Prevention. The fact is that diabetes can't be prevented, but the severity of the symptoms can be reduced with a nutritious diet and regular exercise. A high-fiber diet can control and maintain blood sugar levels in your body. Number 5. Trachea, bronchius, and lung cancer. Trachea, bronchius, and lung cancer are the types of common respiratory cancer. These types of cancers are caused by smoking, partial smoking, and environmental factors. Household toxins, such as the burning of fuel and mold, are also considered to contribute to the disease. Impact on the world. According to a study in 2015, 4 million people died of respiratory cancer. According to reports, it was proved that due to pollution, respiratory cancers had increased 81 to 100% in developing countries. Solid fuel emissions, such as burning coal, caused lung cancer, leading to 17% of deaths in men and 22% deaths in women. Factors: smoking, tobacco usage, family history, environmental factors. Prevention. The prevention of respiratory cancer is to limit and no use of tobacco or smoking. Another prevention is to detect cancer as early as possible to prevent it from getting severe. Number 4. Chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is a lung disease that makes breathing difficult. it is a progressive disease, thus it gets worse over time. Chronic obstructive pulmonary disease has two types: chronic bronchitis and emphysema. Impact on the world. In 2014, it was estimated that over 64 million people were living with chronic obstructive pulmonary disease. Factors: smoking or partial smoking, chemical fumes that harm lungs, family history, prevention. Unfortunately, chronic obstructive pulmonary disease can't be cured, but you can take specific steps to stop smoking or partial smoking from reducing its severity. Number 3, lower respiratory infections. An infection in the air passageways or lungs is called a lower respiratory infection. Causes. Following are the causes: influenza, pneumonia, bronchitis, tuberculosis, certain bacteria, viruses, coughing. Factors. Following are the risk factors: flu, bad air quality, smoking, weakened immune system, asthma, HIV. Prevention. The best prevention in lower respiratory infections is flu shots and vaccines. Good hygiene and regular use of sanitizer can help prevent the disease. Number 2, stroke. Blocked or weakening arteries can cause strokes in your brain. When a person suffers from a stroke, their brain cells start dying within minutes. Symptoms: confusion, trouble walking, unclear vision, numbness. Strokes cause long-term disabilities in the patients. If the patient is treated within 3 hours after a stroke, the patient is likely saved from any permanent disability. Factors: high blood pressure, family history, smoking, females. Prevention. Adopting a good lifestyle with less drinking and smoking can help prevent a stroke. High blood pressure, that is a cause of strokes, can be treated with medicines. Number 1, ischemic heart disease or coronary artery disease. When the blood vessels that carry blood to the heart shrink, it causes coronary artery disease, which is considered the deadliest disease for humankind. CAD causes chest pain, which is its symptom. It also leads to cheating failure and arrhythmias. Risk factors: high blood pressure, smoking, family history, diabetes, high BMI, high cholesterol. Prevention. Here are a few steps you can take to reduce the chances of CAD. Regular exercise, a healthy weight, nutritious diet, moderate drinking and smoking.